Hi, my name is Karen Sierra, and today I'm going to be talking about Graves' disease. So what is Graves' disease? Graves' disease is an autoimmune disease. It's also commonly referred to as Basedow's disease, exophthalmic goiter. It primarily affects the thyroid gland, and as a result, the thyroid gland will make way more thyroid hormones than the body will need, and as a result, it will lead to many of your bodily functions to speed up and cause issues later on, which I will discuss here in a bit. But before I get into that, I just wanted to talk about the historical perspective. So the first description of this disease was back in 1000 AD by a Persian physician who described the goiter and exophthalmos in the patients. And it wasn't until centuries later, in 1786, a man named Caleb Hiller Perry described that the postpartum period as well as strong stresses are now recognized as the reason for this autoimmune thyroid disorder in people. The disorder didn't get named until 1835 by a man named James Graves. He described patients with the association of palpitations, goiter, and exophthalmos. He even released a literature called the Clinical Lectures on the Practice of Medicine, where he describes it there. And as a result, they named this disorder after his last name. As I mentioned in the beginning, this Graves' disease is also known as Basedow's disease. That's because in 1840s, a man named Carl Adolf von Basedow described 3 patients sharing the same clinical features that James had described, and was the first to recommend treatment with iodine and bromine. So he wasn't aware of James Graves' publications, so as a result, the people in his area started calling the disease Basedow's disease, so that's why they have the 2 names. And it wasn't until 1958 these men named Adams and Perv were able to identify TSH receptor antibodies in the thyroid gland and discovered their ability to compete with the actual thyroid stimulating hormones for binding to thyroid membranes and causing hyperthyroidism. So because of that, from now on, it has been labeled as an autoimmune disease. So I just wanted to go over what cells are involved and how this works in the body. So firstly, the thyroid gland will release a peptide called the TSHR peptide, and the dendritic cells will take up these TSHR peptides, and as you can see, the dendritic cells will present their MHC2 molecules and present this TSHR peptide that they have now taken up to the T cell receptors of the T lymphocytes. And so after that, the CD154 molecule will go on to recognize the CD40 molecule of the B lymphocytes and will bind. So as a result, the binding will initiate the costimulatory pathway and will provide that first signal needed to initiate the adaptive humoral response. So after the binding, the B lymphocytes will then secrete the TSHR autoantibodies because of that peptide that's being presented to the T lymphocytes. So these autoantibodies will then bind to the thyroid stimulating hormone receptor on the thyroid gland, and so this autoantibody will stimulate proliferation and hypertrophy of the thyroid cells, which will ultimately lead to the overproduction of the thyroid hormone, which will lead to hyperthyroidism. Another way that this autoantibody works is that it also acts on the thyroid stimulating hormone and the IGF-1R on the orbital fibroblasts. As a result, this will release pro-inflammatory cytokines, which will intensify the orbital inflammatory processes, which leads to the Graves' orbitopathy, the eyeball herniation, which I will discuss later on. And so, as a result, the Graves' disease is commonly known as the type 2 hypersensitive response. Again, it's a autoantibody-mediated cytotoxic events. The plasma cells are producing the antibodies specific to the TSHR found in those thyroid cells. So they're going to mimic the natural ligand and again cause thyroid cells to become dysfunctional and overproduce that thyroid hormone, which will lead to hyperthyroidism. So that's why it's commonly known as type 2. So what happens when you get this disease? So here are just some of the symptoms. So as I said in the beginning, you commonly get hyperthyroidism. The second thing you can get is skin problems. So that's just going to be that rash, redness, irritation, dry, itchy. And then you also get eye problems, like I said, because of those pro-inflammatory cytokines that's being released. You're going to get these bulging eyes, the eyelids will be retracted, and there will just be a lot of irritation that leads to the redness of the eyes. So as I said, for hyperthyroidism, you see this picture of what the normal gland would look like, but developing this autoimmune disease will completely enlarge the thyroid by a lot, abnormally. And so with hyperthyroidism, you develop goiter, as I said. You can develop rapid heartbeat. You can have a lot of loss of weight even though you have an increase in appetite. You'll have frequent bowel movements and muscle weaknesses. As well for the eyes, you will get bulging eyes, as I said, gritty, irritated eyes. You're going to be sensitive to the light, and you'll have a lot of pressure and pain behind the eyeballs, and you will also get blurred vision. So this is just how you diagnose the disease. So for the blood test, you're going to be able to measure the levels of thyroid hormones and check for TSI. There's another thyroid scan, which helps how and where iodine is distributed in the thyroid. There's another diagnosis, which is called the radioactive iodine uptake test, which basically just measures the amount of iodine the thyroid takes up from the blood. So if there is a large amount of iodine, that will just indicate the Graves' disease. And last but not least, they have the Doppler blood flow measurements, which this one was really interesting to me, was they use sound waves to detect the increase in the blood flow of the thyroid. Because it is so enlarged, there will be an increase in blood flow, so that's what this measurement is looking for. So what happens when you get Graves' disease and how do we treat it? So first and foremost, they're going to look towards medicine, and first they're going to look at beta blockers for you to take. So beta blockers, it's in the name, they just block the actions of substances such as things like adrenaline, nerve cells, and they cause the blood vessels to relax and widen. There are other antithyroid medicines. One of them is called methimazole, and the other one is propylthiouracil, which is only for pregnant women who are 3 months into their pregnancy. And secondly, you can go through radioiodine therapy, and that's just taking radioactive iodine through the mouth as a capsule or liquid. And thirdly, you can have thyroid surgery, which either part of your thyroid is removed or your entire thyroid is removed. But removing part of the thyroid can regulate those overproduction of the thyroid hormones, or removing the thyroid in itself will cause more problems, and as a result you'll have to take thyroid hormone medicine to replace the absence of the thyroid hormone that gland is supposed to make. So you're going to be taking that for the rest of your life. And so for GO, which is the Graves' orbitopathy, if you have a mild case, they just recommend things like eye drops, sunglasses, eye masks. When you go to sleep, they recommend you to tape them shut or to raise your head at a certain angle in order for it not to bother. For severe cases, they recommend things like steroids and surgery. So the people who are at risk are, first and foremost, if you have a family history. So Graves' disease can run in families, but there's still research being done if there are certain genes that are involved in Graves' disease, but so they're still finding that out now. If you have other autoimmune diseases like type 1 diabetes or lupus, you are more at risk of developing Graves' disease. As I said in the beginning, if you're under stress or you recently had a baby, again, you're more at risk. Researchers say that women are way more likely to get this disease than men. So another thing is history of infection, and that just may play a role in the development of Graves' disease. So researchers had found a link between Graves' disease and infections of certain viruses in the past, so that can also be another factor. And last but not least, smoking. So if you smoke, you're at risk for Graves' disease. It's also a leading factor of the eye problem, the GO. That's like the highest leading factor of it. So that's just who's all at risk. And here are my resources, and thank you for watching.